yes, or University of Petroleum and Energy Studies in India. Dehradun, yeah, I has been there. Dr. Achimatur specialized in microfluidics, okay, nanotechnology, connected health, which is we focusing on today, okay, sensors and point of care devices, okay, with a strong commitment to the improving healthcare accessibility and affordability. So his research focused on the developing innovative technologies with societal benefits. Okay, so it's the same aim as our group as well. Dr. Matul's work comprises of the design and implementation of low-cost, okay, portable sensors for various applications, including healthcare diagnostics and environmental monitoring. Okay, his research has a far-reaching practical implication, particularly in the realm of healthcare, because focusing and emphasizing on the healthcare. His work in developing low-cost, user-friendly point-of-care devices and sensor empower healthcare provide individuals to access rapidly, okay, and accurate diagnosis, even in the resource-limited settings. Okay, all of this technology have potential to revolutionize healthcare delivery, enabling early disease detection, okay, and also individualized or personalized treatment strategy and remote monitoring. That is the future as well. So he draws inspiration from the pressing needs from affordable and accessible healthcare worldwide. Yes, reaching out to us as well, witnessing the barrier that hinder optimal healthcare delivery. Is driven to develop practical, yesterday we used this word, practical solutions that address this challenge by combining his expertise in microfluidics, nanotechnology, and connected health. Okay, Dr. Matul's aim to democratize diagnostics and empower individuals and communities for everyone. Okay. So that's is the thing that I can say about him. So Archie, please
Thank you
bring
so
us
much.
from here, take us from here.
Thank you so much, Professor Sanong, with a very nice and elaborative introduction. So, good morning, all of you. Good morning from India, and I am Ashish Mathur. You can call me Ash. And thank you, first of all, to the organizers for inviting me in this wonderful session and give me the opportunity to interact with young minds. This is my passion to interact with young individuals and talk science with them. So, Dr. Jack, Dr. Sanong, and Dr. Sudket, all of you, thank you so much for this opportunity. So, with your permission, Professor Sanong, can I start? Yeah.
Yes, please.
Yes, sure. So I'm going to speak about point of care devices, smart, affordable technologies, which we are developing with our startup. And with this, I would also like to speak about how these technologies transform not only the healthcare, but our education system as well, right? So, like this. Yeah. So, to start with, diagnostics is currently um, for everyone. I mean, this is healthcare is one of the basic necessities across the world. But what happens currently is that half of the world has very little or no access to these diagnostic techniques, you know, especially in the second, third world countries where we don't have a very strong healthcare infrastructure. There, we don't find people are very used to these diagnostic techniques. If we talk about the market, the market is huge. It's almost 20 billion US dollar global market. And with these diagnostic tools, early warning diagnostic tools, approximately 1 million and over preventable deaths can be can be diagnosed and detected early, the diseases. So we can actually start the diagnosis with the help of smart diagnosis. We can start the treatment early, so we can actually save some patients' life. So as I said, the agenda of this talk is initially we'll see the diagnostic gap in globally, then the point of care technology platforms which we are developing, which you also can develop, what certain applications we are working on, and then how it will help in for the society and education. So, if we talk about the diagnostic, there's a huge area of diagnostics. So, if we talk about various diseases, diabetes is the one which is the very common disease across the world, right? So, as per the WHO World Health Organization Bulletin 2025, approximately 80 to 90, 85 to 95% of the untreated cases in low and middle income countries were undiagnosed. Imagine people have diabetes, people have a deadly disease, but they cannot diagnose it. They don't know whether they have this disease or not. Why? Because the diagnostic tools available in the market sometimes are expensive, sometimes are not reachable to them, and sometimes there is a social taboo as well for going to the diagnostic center, going to the hospitals. People, they don't like it, right? So nearly half of the population, global population, have almost no access to the diagnostic tools. Now, what we do is, or what my company and what our research group is doing, that this problem cannot be solved alone. We need to have an interdisciplinary work. People from science, people from engineering, people from social science. Everybody has to come together. People and people from law, people from medical, and then they have to work together to provide a common problem. So what I propose is paper-based microfluidic devices. Why paper? Because first, it is biodegradable. So normally the conventional tools are plastic based, right? So they add plastic contamination to the environment, and they cannot biodegrade themselves. So therefore, paper based microfluidics provide low cost, environmental friendly alternate for the major diagnostic tools. Then the integration of artificial intelligence and mobile computing is very important. So everybody nowadays have smartphones, right? You use your camera for making reels and for other things, but these cameras of mobile phone can also be used to save somebody's life, right? So I'll tell you in coming slides how we can do that. And then we need frugal engineering, frugal innovations, right? So that how do we add engineering solutions to this complex problem and provide solutions which are very low in cost so everybody can use it, right? So idea is to make low cost devices which can be used by everybody. Everybody means everyone available whosoever is suffering from any disease globally, they can use these devices. Now let us understand what point of care diagnostics means, right? So point of care test is performed where the patient is, right? So it does not, you do not need to move the patient to the hospital or to the lab. So the patient can self test, or somebody, a care giver can test problem of the patient by taking one drop of blood or sweat or saliva or urine, anything, right? Then these tests can be performed by the bedside of the patient. You don't have to move the patient somewhere else, right? And the results within few minutes. No lab requirement, no cold chain, no specialist required. That is what point of care diagnostic means. So World Health Organizations has given a defined standard for these devices, which is called assured, ASSURED, right? These assured. So what does it actually mean? Assured, affordable. Affordable means low cost, sensitive, right? That device should be sensitive enough to catch the uh, uh, target disease very quickly, right, and very effectively. Specific, specific means that it does not give false positive. So if you are checking diabetes, it will give only diabetes, right? It should be user friendly. So within very short training, anybody of any age can use it. It should be rapid, right? So it should give results within few minutes, and equipment free. There should not be need of any electricity, any other instrument, right? Only your sample and that strip or that point of care device. And it should be scalable and manufacturable. It can be delivered. So this is what assured means: affordable, sensitive, specific, user friendly, rapid, equipment free, and it has to be delivered means it can be mass produced. This is what point of care devices is. So very common one is like this. You might have seen, like, during the COVID times. It's a COVID testing kit. So it's a low cost, no power requirement, biodegradable, rapid results, and each test costs less than $1, right? That is how it should be. Okay. Now, how do these devices get fabricated or get made? So in this, if you see the X-ray of it, it is, one is sample pad, which is here, right? This is your sample pad. Then you have a conjugate pad. So this whole thing, from sample pad to backing card, this whole thing is a microfluidic channel, right? So sample, here you can put your urine, saliva, sweat, or blood, whatever your sample is. Then you can give a conjugate pad with through which the it will combine with the antibodies. This is a nitrocellulose membrane through which the fluid moves, and there is a hard backing support, which is also a plastic, a thicker plastic, to give a support. And then, because of this conjugation, you'll see one or two lines, and depending on what type of sensor or what type of molecule you are sensing, one line gives negative and two lines give positive results. So first of all, we need to understand what senses are, and how do we make sensors out of it. So we all of us have majorly five senses. We can see, we can hear, we can touch, we can taste, we can smell, right? So these are called five senses. Okay. If you add a device to it, so for hearing, we have acoustic sensor. For touch and feel, we have a temperature sensor. For taste, we have physical and chemical sensor. For smell, we have gas sensors. And for sight, we have optical sensors, right? So all of these five senses, if we mimic by an instrument or a machine, these are called sensors, right? You can think of any sensor around you, and you can see it is dependent on one of these senses, right? In your classrooms, in your college or school, if you go, there as a automatic light system. So if you go in a dark room, the lights automatically come on, right? Isn't it? So that is sight sensor, optical sensors, right? It detects motion. Your mobile phone has a lot of sensors, right? All of them mimic one of them, right? So you touch your screen and it starts doing something, right? So that is the mimic of touch senses. Hmm? Sight, hearing, smell, taste, all of these senses we are mimicking. Now out of this, what is a point of care testing? So suppose a patient report an illness. Hmm? So we have to wait to get an ambulance. In many countries, getting an ambulance is a major challenge. In India, it takes a lot of time, and other countries as well. Then, with that ambulance, we have to move the patient to a diagnostic lab where the necessary tests can be performed. Right? It can be hospital, it can be any lab, and then we have to wait for the results. Then, based on these results, we have to move the patient again from that ambulance to the respective treatment center where the necessary treatment can be given. And by that time, we may lose a precious soul, right? So, suppose somebody reported an heart attack, you have to move the patient twice or thrice just to get a right treatment. Do you think the patient can be saved? No, right? So, this is scenario A. What is scenario B? In scenario B, suppose the patient report an illness. You test the patient next to its bedside, right? Where the patient is. You don't have to move the patient. You test him or her. Immediately within a minute, you get the results. And then you have to move the patient to the respective treatment center. So this chain can only be cut short to this part. You only have to move the patient once, and the necessary treatment can be started, and we can save a precious life. So scenario B is an ideal case of point of care testing, right? Do you get the point? So what point of care testing means? That the test has to be performed next to the patient without the need of moving the patient to anywhere else, so that we can minimize the decision making loop. That is what point of care testing means. I hope the concept is clear of point of care testing. So when we make these point of care devices, so we need to analyze the disease. It has to have a ease of manufacture. These days we are using artificial intelligence, machine learning, Internet of Things, everything together. It should be easy to handle. So any age group can handle. So kids can also handle, adults, and then elderly. So world is moving towards the elderly age group. So everywhere we have lot of elderly patients. So easy to handle by elderly, and it should be accurate and affordable, right? Affordability is very important along with accuracy, right? These are the qualities of point of care device techniques. Now, how do we make point of care devices, right? In order to make point of care devices, we need nanomaterials, right? I hope you know what nano means. Nano means any material when it is reduced down to the size of 10 to the power minus 9, then the material gives very novel properties, right? For example, if you reduce iron, which is a good conductor of heat and electricity, to the nano dimension, it becomes insulator, right? There are many insulators. When you reduce down to the nano size, they become conductors, right? So when you move anything into this regime nano material range, which is 10 to the power minus 9 meter, then magic happens. So lot of material give excellent properties. We can have a nano introduction to nanomaterial session separately, but these nano materials have a very unique properties. So in order to explore those properties, we use them in point of care devices. Then we need low cost microfluidic platform. As I said in previous slide, the paper based microfluidic platforms can provide very easy platform so that fluid can transfer from one place to another place. Then we have to have a very good electronics, novel transducers, right, which can convert. Do you know what transducer is? A transducer can convert one form of energy to another form. So for example, on your point of care devices, when your blood reacts with a biomolecule, it can generate a chemical reaction. So out of this chemical reaction, the transducer can convert this chemical energy into electrical energy, right? And then we can use it further for data analysis. So transducers are device which can convert one form of energy or one form of signals into another form. So we need very novel transducers which associated with the respective point of care device which we are making. This is also one of the very important building block. And further, in order to process the signal, we need electronics, artificial intelligence, and machine learning. So all these four nanomaterials, low-cost microfluidic platform, novel transducers, electronics, artificial intelligence, and machine learning together can give a very important and very novel, with that assured criteria which we have seen earlier, point of care device, right? Now we'll talk about few application areas. So our group in India have developed this point of care device, which is, the disease is called Hirschsprung. So whenever a child is born, out of 2000 births in India, one child have this disease, right? And in world, every 3000 births have one of this child with this problem. So when a child is born, the situation with Hirschsprung disease is the anal canal route is not developed, so child cannot pass stool, right? This is the genetic problem, right? This is the biological problem, right? So the mortality rate is very, very high. It is, as per the literature, it's 48%, but we spoke to many doctors, it is approximately 98%, right? So with this problem, a newborn baby cannot survive because the child cannot pass stool. So the current method is that doctor have to make a operation, and from the large intestine they have to create an artificial path so that the child can pass stool. Now you won't believe, we are living in 2026. There is no sensor as such in world which can sense this disease early. The current procedure is doctor has to cut open a patient and take tissue samples from this large intestine and then give it to frozen biopsy. Each test for frozen biopsy takes 4 hours, right? And there are only 10 centers in India for this treatment. Imagine, India is such a big country and only 10 centers are there. In rest of the world, there are very, very less centers, right? Therefore, the mortality rate is so high. Therefore, we have developed a sensor which is very, very portable, low cost, and it can be taken inside operation theater. So this is our sensor strip paper-based microfluidic. So doctor has to take a tissue sample from that large intestine and put it on top of this area which is here, right? And within few seconds they get to know the result which is given same by frozen biopsy, whether to take that uh, cut from there or somewhere else, right? So imagine the task which was taken 4 hours early, now it can be given in few seconds, right? So with this device we have given to few centers in India, and we have tested this first electrochemical sensor in world. So we have tested with over 50 patients in India, and very successfully the mortality rate now is getting reduced. So this is the first electrochemical sensor in world which we have developed, which our group has developed for this particular disease. There is no electrochemical sensor in world. If you Google this disease name, you will find our name, right? So this is at technology readiness level 9 already. So we are commercially selling it, right? And this sensor what we have developed uses nanomaterial, novel transducer. So inside this white casing, electronics is there, and then it can be inserted in any computer or a laptop or a mobile phone, and then it can be the software can be run there. Now, the second problem which we are dealing with is diabetes. Diabetes is a big problem globally and in India. Every one in any 3 house will have one diabetic patient, right? And diabetic patients have a very, very big problem of diabetic foot ulcer as well, right? So 25% of diabetic patients are actually likely to suffer diabetic foot ulcers, right? And this the problem of diabetic foot ulcer is not only DFU, it can be strokes, heart attack, you know, cataracts, glaucoma, and so many other things as well. And if the diabetes is not treated early, 25 to 50% of diabetic foot can be or has to be amputated. So doctor has to cut the leg if this is not treated. So that is the foot ulcers. So we have developed a sensor to measure glucose, which is diabetic. So diabetic sensors are commercially available as well. But what our sensor is doing, it measures the diabetes by 3 ways. So normally, which you see the diabetic sensor in commercial market, which is called glucometer, is majorly enzyme based, right? Our sensor measure it in 3 ways: enzymatic, antibody, and molecular imprinted polymer based. So these are the 3 approaches which we are using. Now what is the advantage of it? You will not get only the immediate diabetic readings, you can also get last 3 months profile from the same sample, right? And these are use and throw ones, but the enzymatic ones have very, very small shelf life. So if you prepare this sensor, it can last only for a month or so. Whereas molecular imprinted polymer sensor based technology, the sensor can last over years. So you can store them and use it for years. So therefore, all these three techniques combine in our sensor, which you can see in Dr. Sutket's lab as well. We have given him the samples. So you can measure not only the glucose, you can also measure HbA1c, HbA1c, which gives you 3 months glucose profile. And these sensors are made by molecular imprinted polymer technique, which can with the shelf life of over years. So these sensors you can prepare and keep for years with you, right? And everything with just one drop of blood, right? So each test cost um how much? Less than one baht, right? Whereas if you go to the market, I'm sure it is 30 to 40 or maybe 100 or 200 baht. So this is how the actual device looks. Nianic is the name of our company. Then we have this display. We have this slot where the sensor can be placed. It has the same charging port as in your mobile phone. And then you have an on-off button, right? So a very simple and handy and portable device. So the same device can be used for detecting diabetic foot ulcer as well. So for diabetic foot ulcer, the biomarker which we are detecting is called tyrosine. So the same drop of blood, you put it on the sensor surface, and within few seconds, it gives you the reading, which tells you the concentration of tyrosine, and it tells you whether the wound is chronicity is low or high. Chronicity means the condition of the wound, the pH, it measures the pH, and it measures the condition of the wound as well. So not only the glucose, it measures the diabetic foot ulcer as well. So diabetic foot ulcer, normally what happens, diabetic patients have these type of ulcers around their foot, right? So you have to put it under the bandage. So we have created this bandage itself, which can be placed on top of the wound, and without opening the bandage you can see the condition of the wound by it gives you continuous reading. What is the condition of the wound? If it is green, that means it is safe. It is red, then we have to take proper medication accordingly, right? So the clinical trials, we are doing it in one of the medical college in India, and this is again at technology readiness level 9, so that is almost in the commercial level. Now the third most common problem around the world is cardiovascular disease, heart attacks, right? Every 7 minutes somebody dies from heart attack in Canada, right? Every 7 minutes, imagine, right? And in England, every one in all four deaths is almost every 4 minutes people are dying because of heart attack. Every 11th person in the world suffer from heart related issues. So it's such a big problem, global, right? Now what we are doing is we have created a very nice and paper based microfluidic sensor to detect heart attack in advance. So there is a biomarker which our body produces. Biomarkers are basically chemicals which our body produces whenever we suffer from any disease, right? So if somebody is suffering from cardiovascular disease, so cardiac troponin I is the biomarker which our body produces, right? If the concentration goes above 2 nanogram per liter, then we can say the person is suffering from cardiovascular disease. So we have developed a sensor with a very novel, very new nanomaterial, which is called niobium amexine. So amexines are a new form of two-dimensional nanomaterial. Niobium is an element, right, which looks like this, right? How do you call it? It's um, like spring rolls sheets, right? Pastry sheets, right? But these are in nano dimensions, right? And this is a two-dimensional, like a paper sheet, right? Stacked one on one top of each other, and they are very conducting in nature, highly conducting, right? So we have added cardiac troponin I antibodies on top of these electrodes like this, right? So this is our paper electrode, and within this is the working electrode. On this working electrode, initially we put this niobium emexine, and on top of it, we added this biomolecule for cardiac troponin I, right? Now, whenever you add a blood on top of it, and if that blood have this biomolecule, cardiac troponin I, it measures the concentration, right? And if that concentration is above a threshold limit, then the sensor warns you that you have to go and see the doctor. It does not treat you. These are only the diagnostic device. It will only tell you whether what is the condition or what is the concentration of these biomolecules inside your body. So whenever it gives you a warning, you have to go and meet the doctor, right? Again, this is on the same platform which you have seen, right? Next problem which we are dealing is with is cancer, right? We all know how deadly this disease cancer is. So we are working on male and female cancers both. So in male, prostate cancer is a very, very important and very pertinent problem, right? Many persons, many males are suffering from this, especially above 45 years of age, right? So we are working on this microfluidic platform to work to detect prostate cancer, right? So it takes one drop of urine sample, and within few seconds it tests whether you have biomarkers for prostate cancer as well, right? So we are working on this very specific device, right? Similarly, we are working on lung cancer devices as well, right? And prostate cancer as well. So it takes 5.5 million deaths, right, in globally in the age group of 55 to 65 years. As per the WHO data, cancer patient will increase by 70% in upcoming 2 decades. See the deadliness of this disease. Now, my second company, Hernostics Private Limited, is working on female health, right? So we are working on cancer devices to detect cervical cancer and breast cancer both, right? Again, on the same platform. So if you see the country and the cases, in China, we have over 1 million, 1.5 million cases. India, huge. Indonesia, Brazil, Russia, US, Nigeria, Japan, Tanzania, South Africa, right? Cervical cancer patient is increases day by day. So these are some of the reports in newspapers. So our device, again, we are using emexine, which I have shown. This time we are using, instead of niobium, we are using titanium emexine for this work. Again, the choice of material depends on various parameters. Very important one is what type of bonds that nanomaterial can provide. So sometimes it is it can bind covalently with the target molecule. So we need to have sometimes carboxylic group, sometimes we need oxygen group, sometimes we need amide group. So depend on the chemistry of the nanomaterial, we choose the nanomaterial for what particular application we need. One of the very important point is the conductivity, right? So we just put a drop of this nanomaterial. On top of this, we add the biomolecule. For the breast cancer, the biomolecule is called HER2. And then there is an interaction on the surface, and this device gives you results within few seconds. So we are testing this with real patients. We have already tested around 100 women successfully with this with our device. The second one is breast cancer. So now the problem is with this breast cancer is not only in women, males also have this breast cancer issue, rare but real, right? So every year we have 1.38 million new cases. Every 4 minutes a woman diagnosed with breast cancer, and every 13 minutes a woman die in India because of breast cancer. See why this problem happens? Because the diagnostics tools are not available, right? So we have the tools are so expensive and very difficult to get globally. Therefore, the deaths are there because the cancer has to be diagnosed as early as possible. If it is not diagnosed early, then there is a very, very less chance of treating the patient, right? Therefore, it is important for us, right? So our device helps in getting the diagnosis quicker, right? It is only a screening device. It will tell whether the disease is present or not, right? And then if it is present, you have to go and see the doctor. The next device which we are working on is again palladium based MXene, palladium titanium based MXene for women health related applications. So women have this problem called PCOD, right? Where where their hormones are getting imbalanced, right? So we cannot predict their ovulation, and we cannot predict various problems in women. So we have made this sensor, and currently it is in test phase, which can detect the concentration of a biomolecule which is called LH, luteinizing hormone, right? So it's a hormone sensing device. So there is an antibody antigen type of reaction, and it can tell whether the patients can be screened on this device as well. So, Professor, my slides are not changing. Is that right?
It it's something's happening. Maybe you need to reshare again.
No, were you able to see my slides?
No.
No.
No,
Oh,
I don't see.
why didn't
Me
you tell me
neither.
early?
Stop
No,
sharing
no,
it.
no. Earlier it's okay. Earlier it's okay, but just once you stop talking, at the moment it just disappear.
Oh, okay, okay, okay.
Okay, yeah, yeah. We
Wait,
we saw the whole your presentation earlier.
can you
Yeah.
see it now?
Yes, yes,
Yes,
yes,
And you can
yeah,
see
I can see now.
the LH sensor slide?
yes, yes,
Yes.
yes. We
Okay,
saw this earlier.
okay, okay. Thank you. Right? So we were dealing with this sensor called luteinizing hormone sensing for PCOS detection in females, right? So with this device, we call it Sync Her Ovuwise, right? So it detects the hormone and menstrual cycle in women.
Good.
Then we are working on this device which is which is an electrochemical sensor to detect uric acid, right? Uric acid is another very important biomarker for kidney dysfunction and osteoporosis, right? So we have made this biomarker using a nanomaterial called borofin. Again, this is a two-dimensional sheet of boron reduced down to nano size, and this is called borofin, right? And this can detect uric acid, ascorbic acid, and we can predict the kidney health and the head health of bones, right, of a patient. And all these sensors are affordable, low cost, and give quick results. Within few minutes, it gives you the results. So you don't have to go to the screening labs for anything, right? So these are all the sensors which we are working on, which are at clinical trial phase, right? Now, for students, once you make these devices, how do you take it? And, take it to the patient, right? So these devices, as I said, are very very small. It can be taken in the pocket, right? We are working now on colorimetric devices, which are like this. You can see on your screen. It You can take an image of this from your mobile phone, and it can give you a colorimetric readout. They have a AI assisted interpretation, geotagged reporting, so location can be tagged, and you can predict. A patient can test by themselves and predict the problems, right? Now, when I started my talk, I spoke about frugal innovation. So, what this frugal innovation is? So, frugal innovation is not about doing more with less. It's about doing the right thing with exactly what is available. So, whatever resources we have, if we innovate a product out of it, if we innovate a prototype out of it, it is called frugal innovation, right? So, then from bench to field, right? So from your lab, once you have created a device, how do we move it from there to the hospitals, to the doctors? So there is a 5-stage pipeline, right? So first we have to start with the basic research. So we have to do, we have to create nanomaterials, we have to make the conjugate, we have to find the biomolecule, right? So the basic research is required, how much amount of what we need, right? Then we have to have a prototype development. We have to have a machine, we have to have a control electronics, we have to have a screen printed electrodes. All this we have to develop, right? Then we have to validate with few clinical specimens, right? We can spike serum samples, we can spike blood samples, we can create artificial urine, artificial sweat, right? And then lab validation has to be performed. Then further, the device can be taken into field, right, with the doctors, and then relevant tests can be performed. And once we get the results from good results from field validation, it can further be scaled and deployed. So the various stages can be classified as technology readiness level. So NASA has given this technology readiness level benchmark from 1 to 9. And if it is cross 4, that means your field scale prototype is validated, right? Now, how does it help in education ecosystem? So the same device which can diagnose these diseases can also teach. How? If you see on the surface of these electrodes, there is a biochemistry, right? So students can synthesize this colorimetric reagent, they can fabricate the device, they can run real assay, not in simulation, but in real working condition. So biochemistry they can read, they can learn. The design aspect of the device, they can create electronics, they can write codes, right? So engineering they can perform, and ethics by default. So every student must ask who will use this, who won't, right? So you can actually create this device for specific purpose, right? Who is going to use it? Accordingly you can design your devices. Now, this cannot be done alone. So there has to be interdisciplinary working groups. So persons from life sciences, students from engineering, data science, and public health all combine together to make these point of care devices. So engineering students can design microfluidic platforms, sensors, materials. Public health can give assessments in co-design, community health working, sampling with real patient. Data science students can give image analysis, machine learning, data modeling. Life science students can help in immunoassay design, biological signal pathways, biomarker physiology, and so on. So what I propose, that we have to embed this thing in our curriculum, right? So the model is, the curriculum integration pathway is, in year 1 and 2, principles of biosensing can be taught to students, lateral flow bioassay, theory, global health. Year 2 to 3 for lab practicals, fabrication of paper-based microfluidic device, smartphone image analysis. Year 3 and 4 can be capstone projects, clinical need translation, validated prototype can be done. And finally, the students can participate in industry research, regulatory pathways, and scale up strategy can be performed. So the model is design, fabricate, and validate PO point of care devices, work on real clinical problems in cross-disciplinary or interdisciplinary teams, and build functional prototypes, right? And work on applied hands-on training. So innovation driven education, right? A new pedagogy we have to perform. So this is, I'm speaking about how point of care devices, how these modern tools and techniques help in education. So real problems can be given to students. Students can perform applied skills. They can connect science, fabrication tools, validation, and compliance in one project. Prototype is must. So when you make, then only you can say, right? So as per the saying, if you cannot own it till you hold it, right? So you have to hold it, you have to create it, you have to you need to get your hands dirty. Only then you can get to know these things. And you all are future leaders, graduates, with innovation is what world needs, right? So what happens when students build real things? So embedding point of care research into undergraduate or postgraduate undergraduate curriculum produces measurable shifts, not just in grades but how students think. So you're more likely to pursue global health or social innovation, so it becomes 3 times more. 89% higher confidence in interdisciplinary problem solving compared with traditional lab courses. 67% growth in working prototypes in one semester, and 12 months in student-led projects reach to the next stage. This is the time required, right? Minimum time required to have a capstone project. Now, industry can help. For example, my startup, Professor Sudhket's startup, and SUT have a lot of other startups and connection with the industry. They all can help collaborating with academia in collaboration mode. So university research can have a knowledge, talent, publications, scalable point of care innovations. Government NGOs can also participate and industry partners as well. So university research can generate fundamental knowledge. It can give necessary trainings. Industry partners can provide real world problems, and government and NGO can provide the necessary framework, regulations, funding, and so on. So it needs an industry academia model to take point of care research further. Now, how does startup led implementation from lab to market works? So first of all, you have to have lab validation. So you have to refine your prototype, you have to prove the concept and so on. Second, you have to have a startup formation. So all university nowadays have a incubator system within themselves. So you have to see how to spin out a venture from an incubator. So you have to perform the regulatory compliances. So different countries have different compliances. We have to think about it and see how it works. And then manufacturing, how to scale it further. So we have to connect with regular manufacturers. And then we have to see how market adopts our device. So all this takes 18 to 24 months, all from lab validation to market adoption, right? This is how a startup in this field can be built up within 2 years. Now I'll take a case study. A university lab develops a glucose sensor. Student teams were formed under innovation curriculum. Then year two incubator got funding. Pilot validation with 500 patients across three rural clinics was performed. Year three, startup incorporated manufacturing. The partner was identified. Regulatory compliances was done. Year four, this startup has launched into the market. 15,000 tests deployed, and the clinical health workers training program was established. This is a case study from one of the startups in India. Now, how does it impact socially in terms of healthcare and accessibility? Over 10,000 plus patients were screened by this startup, 60% reduction in diagnostic delays, 15 rural communities were served. Early deployment shows the number of patients screened from 2022 to 24. Time to result reduction from days to minutes. User acceptability was increased to 92%, and the average cost per test was less than $1. This is what an ideal scenario for any startup in this domain, right? So uh, the diagnostic device is aligned with the SDG goals. I'm sure you all know that SDGs have different goals aligned with different numbers. So SDG 3 is for good health, SDG 4 is for quality education, SDG 10 is reduce inequalities, SDG 17 is for partnership, SDG 9 is for innovation. So social development goals is what SDG means. So point of care in digital society, surveillance and data, real-time disease mapping is required, outbreak detection should be required, Policy ready data needs to be done, and population health trends need to be performed. So what next? In coming generations, what we need is point of care devices with an integration of artificial intelligence is our next frontier. So what we need is a technology which can capture image, provide ML machine learning analysis, easy output which can be read by elderly and any age group of patients, and it should give cloud sync results as well. So this is what a next generation point of care device should look like, right? Everything within your mobile phone, no extra hardware is required, right? What we haven't solved yet, what in point of care industry, what we have not done yet, what needs more time. So we need to sort out the problem of storage and shelf life of these biomolecules. See, whenever these biomolecules comes out uh, in the environment, the shelf life of the electrodes gets degraded. Therefore we need to find ways to store them to increase the shelf life. We need to have a regulatory pathways, so no fast track point of care approval framework exists, right? So we need to provide a regulatory framework in this respective areas. Multiplexing needs to be performed, so one sensor should perform different types of analysis. So for example, a diabetic patient may also have a kidney malfunction, so the same sensor can provide both type of data. And then scale up economics, so the test needs to be the each test cost has to be minimized, and the production needs to be increased, and everything has to be validated on evidence based model. So these are some of the pain points in this point of care diagnostic device technologies. So overcoming the evidence gap, for that we need to have a pilot study, multi-site validation. So it's not only a device can be tested in India, it has to be tested in various countries, and within a one country it has to be tested multiple locations. Peer review, we should be open for the feedback. Peer review processes, regulatory submissions needs approval pathways quicker, and then finally the deployment. So research, innovation, and education, we have to reinforce this loop. So innovation needs to, so the research, whatever we perform the benchtop research needs to see the light of the market with the innovation. So it should translate into the deployable product. And both of these should integrate with the current education system. Only then the whole loop can be shortened, and then research, innovation, and education can perform a brilliant outcome. So for building a innovation ecosystem, university, industry, government, and healthcare system all has to come together to perform a joint effort in this area. And students, you who are listening to me from last one hour and above, you are the innovators. You are agents of change. So you have to be prototype designers, field testers, community licensing has to be performed by you. And I'm sure most of you will found a startup very soon, right? So these are the things which we are expecting from young generations. So as I call you agents of change, right? So what students learn, system thinking, scientific communication, cross-disciplinary communication, what policymakers like us can do specifically for students, create point of care specific regulatory fast track pathways, move national essential diagnostic lists from paper to practice, mandate local manufacturing partnerships, fund the translational gap, right? This is what a policymakers need to overcome these problems. What academic institutions can do, restructure research incentives, build shared fabrication infrastructure, institutionalize industry co-supervision, invest in global health partnership. A global vision for daily diagnostic equity. So most of the primary countries should participate, tests should be deployed, and cost needs to be reduced. Now, nowadays we are all publishing in open science. So open science can provide low barriers, shared knowledge, and accelerate local deployment through timely accessible resources. Therefore, we need to think more in publishing in open science. Environmental sustainability for paper-based microfluidic device. Biodegradable substrate needs to be used. Minimal energy footprints, as these devices does not need any energy, therefore minimal energy footprint is required. And because this fabricating of these devices needs a very low carbon manufacturing techniques such as inkjet printing, wax printing. So therefore they do not provide big carbon footprint, right? So 90% less waste versus plastic based diagnostic device. This is the advantage of paper based microfluidics. Quality assurance is very prominent factor as well. So batch testing needs to be performed, colorimetric calibrations, field validation, and the compliances. Whatever country, different countries have different compliances. So ISO is the one which all countries obey. So therefore ISO compliances needs to be performed. So the road ahead for next generation platform is nucleic acid or DNA based point of care devices. Variable biosensors needs to be performed. There we need these change agents to make variable devices with frugal innovations. Multiplex data needs to be performed. This is how an electrochemical detection in point of care based devices count. Qualitative output, sub-nanomolar sensitivity, right? This is all what is required. Digital health integration, the complete ecosystem, point of care device, smartphone app, cloud platform, health dashboard, and policy interface. This is the whole ecosystem for a point of care device. Right? So what field partnerships can taught us? Technology is designed in high income labs without genuine field partnership. Normally they do fail. So what we need is co-design, trust with the partners, train the trainers, and regulatory performance needs to be performed, right? So the pathway for research translation, how a research can be translated into a startup. So first you can publish, so you can validate your findings, you can get peer reviewed feedback. Then you can file your IP, the patent can be filed. Then the patent can either be licensed to different companies or you can build your own startup. And that is how you deploy your research into the market, right? These are the 5 steps or the pathway for research translation. Intellectual property is very important. So protect your intellectual property, avoid access barriers, and use tiered licensing, open license, deploying in vulnerable communities, the ethical obligations, informed consent required, no harm, and exit strategy needs to be performed, right? So the training the last mile health workforce, recruitment needs to be performed, classroom training is required, hands-on practice on various devices, field deployment, and the support. So that staff can be trained in less than 2 days. So the scaling model actually is, the word is scale. S stands for scope definition. So you need to perform a test to identify your target population, what your biomarkers priority area is, what regulatory pathway you need. C is for capacity building. Community health worker, peer trainers, local fabrication partner needs to be performed, identified. A is for assay validation. So what sensitivity range you need, what shelf life you are expecting. L is for linkage to care. So referral pathways, digital result logging, health ministry data sharing protocols should be in place. And finally, E is the evaluation and exit. 6 months evaluation process, and then as soon as you have a startup, you also should have an exit strategy within you. Now, funding the landscape for frugal diagnostic, government grants, philanthropic foundations are there, Industry partnerships can be explored. Co-development, different development banks have different strategy, and crowdfunding. So all these funding resources are available for this work. So democrating fabrication, the role of maker spaces. So how do we make this? 3D printing, inkjet fabrication, laser cutting, and lab rapid prototyping. Building resilient diagnostic ecosystem. So research discovery of biomarkers, develop the prototype, refine from the feedback, validate through clinical results, deploy in the community integration, and finally the scaling. This is how the ecosystem works. So key literature for this work, I've given this slides to Dr. Jack. He can share with you. So key contributions of this work, interdisciplinary curriculum model, translation ecosystem blueprint I have given, novel point of care platforms I have given, and AI enhanced readout. So finally, I would like to conclude with the convergence imperative. The technology works, the system needs help, regulatory gaps are there, supply chain needs to be strengthened, funding discontinuity is there. So we need, the next step is yours. Policymakers, funders, academic institutions, each have a specific role. Um, we have to come forward to help the society. What we need these days is the policymakers to create point of care specific regulatory pathways, funders to fund this initiative to bridge the valley of death, which is from translational research to the from the lab prototype to the deployment. Academic institutions has to restructure their curriculum, and industry partners needs to come forward to take up these technologies from exclusive or non-exclusive licensing. So with this, I would like to thank again the organizers, my funding bodies, my students, and everybody involved. And thank you for your patient listening. Thank you.